it's just that same type of thing where there's going to be more chances of stimulations in those cells. And so uh, with all of that, it's talking about like how much exposure you have to estrogen. And so I think within that, again, with uh, alcohol intake, we can see kind of higher levels. It's one of those things where it's like moderation is key, right?
Right.
So
100%.
we can definitely see higher rates of issues in patients that are, of course, abusers of alcohol, and more so if we're also dealing with either liver injuries or things of that nature. Breast cancer is not one that I think of as being strongly related with alcohol intake as opposed to head and neck cancers, gastric cancers, liver cancers, that are going to be far more associated with in patients that are drinking a lot more. But it's kind of a circuitous risk that if an individual is drinking a lot more alcohol, their system may have more that they have to process and deal with.
Yeah, I could see where, for example, if I have a drink or two and it affects my immune system, right? Because that can happen. And if your immune system isn't strong enough to fight the cells, because you have cancer in your body, right? At all times, your body just expels it. Am I understanding that
That's
right?
definitely your immune system is constantly in surveillance, and cells typically that are having mutations where they could turn into cancers or have malignant potential, they will typically send out signals that something is wrong, and the immune system will take care of that.
Which the body's pretty neat.
It's also slightly terrifying to be like, oh, my body is constantly trying to kill me. It's a little bit of a morose thought, but in general, yes, your immune system, uh, especially in other types of cancers, namely skin cancers, um, uh, are kind of one of the top things that we think about with patients that are on either chronic immunosuppression or have other conditions where their immune system is really knocked down, that we see that plays a big role in the generation of those types of cancers.
Gotcha. Okay.
Now, I can't unfortunately speak to any expertise on the effects of alcohol on the immune system and how robust that may or may not be. Uh, but in general, again, like what I say with my patients, you know, I don't really like them to take it while they're on active chemotherapy, but when they're in their kind of maintenance phase, in surveillance, I usually do not have a problem with having, a glass of wine here or there. It's mostly moderation that we talk about.
Yeah, well, there's a big movement in our industry towards moderation, but also just not drinking. THC, CBD drinks have really come to the forefront. Tinctures with adaptogens, feel good, things, legal things. um, but with the rise of these non-alcoholic cocktails and beers, you're seeing a lot of people substitute a drink here or there. Restaurants are getting better and better all the time about having mocktails on the menus, and they're getting really good at it. And so I think that, especially with the generations that are coming behind us, there'll be a lot less drinking, I would say. It's just in general, like the baby boomers and our generation. I don't know if you're my generation X or not.
Yes.
Okay. Because I feel like our generation just followed the baby boomers. We just did okay, we'll just do whatever they did. It's the
Well,
millennials that
again,
came in to
I
swinging.
think in general, overall, I think people are doing better about educating themselves on health, and they're interested in for better or worse sometimes depending on what resources people are using to educate themselves. But I think there is, with the internet and the ability to kind of educate yourself on a lot of things, I think there is a push towards trying to kind of be a little bit healthier, understand the full repercussions of either alcohol abuse or smoking, anything like that that can increase your kind of health issues. And we're seeing less cases of, smoking has been a lot less prevalent as we learned a lot more about the risks of smoking. And so I think that's the other thing is there's not really a good way to be able to say what is the safe amount of alcohol that doesn't increase your risk. And so in a lot of those cases, they just say, okay, the healthiest thing is then just don't drink. If we're not sure if it's going to be a problem for you or not, then of course the safest thing is not to drink.
Yeah. Yeah, and that makes sense, you know. But I think it's you look at all the processed foods people eat and all the other garbage out there, and it's like,
Right. Yeah. But
why is
it's
that
not.
not cancer risk?
I mean that's a part of it too, is what we were talking about.
Yeah,
On your list,
yeah,
obesity is definitely a risk, and part of that is just we that may be getting into the just how hard life can be sometimes. When it comes to finding healthy balanced foods can be really challenging, but in general, like I said, in most times, I don't mind if patients have a cookie or a slice of cake or, some ice cream and things like that. So again, I don't want them eating that for every single meal of the day and that be the only
right.
part that they get any nutrition.